Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about uterine fibroids. Uterine fibroids are also called leiomyomas. Leio means smooth, myo means muscles, and oma means tumor. So these are benign smooth muscle tumors of the uterus. In fact, fibroids are the most common type of tumor in the females. The uterus is a hollow organ that sits behind the urinary bladder and in front of the rectum. The top of the uterus above the opening of the fallopian tube is called the fundus, and the region below the opening is called the uterine body. The uterus tapers down into uterine isthmus and finally the cervix, which protrudes into the vagina. Zooming into the cervix, there are two openings, a superior opening up top and an inferior opening down below, both of which have mucus plugs to keep the uterus closed off except during menstruations and right before ovulation. The uterus is anchored to the sacrum by the uterosacral ligaments to the interior body wall of the round ligaments, and it's supported laterally by the cardinal ligaments as well as the mesometrium, which is the part of the broad ligaments. The wall of the uterus has three layers: the parametrium, which is the layer continuous with the lining of the peritoneal cavity; the myometrium, which is made up of smooth muscles that contracts during childbirth to help push the baby out; and the endometrium, which is the mucosal layer that undergoes monthly cyclic changes. Now, uterine fibroids are smooth muscle tumors, and they are myoclonal, meaning that they arise from the single cell of the myometrium that starts dividing uncontrollably. Overall, fibroids most commonly affect women of African descent. Fibroids are sometimes linked to a genetic mutation, with the most common being a somatic mutation with the mediator complex subunit 12 or MED12 gene. Mediator complex subunit 12 is a part of a group of proteins that controls genes' activity. Another factor, fibroid development, is steroid hormones. Fibroids has love affair with estrogen and progesterone. So fibroids have to regulate their receptors for these two hormones and also produce a lot of aromatase, an enzyme that converts androgens into estrogens. When these hormones bind to the mild dream cells, it has a vital genetic effect, meaning it promotes mitosis. Estrogen specifically upregulates growth factors like IGF-1, EGFR, and TGF beta 1. And the progesterone upregulates EGF, TGF beta 1, and TGF beta 3. So the more estrogen and progesterone that are available, the more fibroids is likely to grow. This is why fibroids typically affects premenopausal females and why they grow rapidly during a pregnancy when there's a lot of estrogen around. Another risk factors for developing a fibroids is never having in pregnancy, and breastfeeding, and having many menstrual cycles, and each with a wave of hormones. Finally, the historical risk factors that's less relevant now was exposure to the diethylstilbestrol and estrogen medications that used to be given to pregnant women. Finally, in rare cases linked to hereditary conditions called the hereditary leiomyomatosis and renal cell carcinoma syndrome, also called the Reed syndrome, which causes skin and uterine fibroids and an aggressive form of papillary renal cell carcinoma. Fibroids can be described based on where they are located in the uterus, and the most common type are the intramural fibroids. Submucosal fibroids come from the myometer cells just below the endometrium, and they keep going to the country of the uterus and change its shape. When that happens, they're called the pedunculated fibroids. Lastly, cervical fibroids grow in the wall of the cervix. Uterine fibroids are round, firm, and grayish-white in color, and they can range from the barely visible lungs to large tumors that can be felt on the outside of the body. Sometimes they're solitary, but they can also develop in groups. They are benign, so they don't invade neighboring tissue or spread in other parts of the body. Fibroids are usually small and asymptomatic, but their locations, number, and size can sometimes lead to symptoms, like abnormal uterine bleeding, which takes the form of heavy to long menstrual bleeding, like abnormal uterine bleeding, which takes the form of heavy or long menstrual bleeding. Over time, this can lead to iron deficiency anemia. Fibroids can also cause abdominal pain because the fibroids put pressure on the pelvic organs. Submucosal and intramural fibroids, in particular, are also associated with infertility and high risk of miscarriage. In pregnancy, fibroids can also cause issues such as fetal malpresentations, preterm labor, and postpartum hemorrhage. Diagnosis of uterine fibroids is done with a pelvic exam and ultrasound. Rarely, a biopsy of the mass is done to rule out that it's not a cancerous tumor, called the uterine sarcoma. If it's a fibroid, the biopsy will show a word pattern of smooth muscles, bundles like a wave in the oceans with the well-defined borders. Treatment of uterine fibroids vary. Asymptomatic uterine fibroids are usually left untreated. Symptomatic fibroids can be treated with surgery, either on myomectomy or hysterectomy if the woman is no longer interested in childbearing. Another non-invasive option is uterine artery embolism, where a catheter is used to reduce blood flow to the fibroids, which causes them to shrink. Medications are not typically used for treatment except gonadotropin-releasing hormones, analogs which helps shrink the fibroids before the surgery. Alright, just a quick recap. Uterine fibroids or leiomyomas are benign smooth muscle tumors of the uterus and occur most commonly in women of African descent. They are sometimes linked to genetic mutations and smooth muscle cells, like in the MED12 gene, but estrogens and progesterone can also play a role in their development. Most fibroids are asymptomatic, but some causes abnormal uterine bleeding, pain, and fertility issues.